Good morning, Trinidad and Tobago, and welcome to today's Ministry of Health update on the national COVID-19 response. It is certainly a pleasure to be here with you once again. Today on our panel of presenters are Dr. Avery Hines, Technical Director, Epidemiology, Ministry of Health, and Dr. Adish Surjusing, Director in the Directorate of Women's Health, Ministry of Health. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health, and I will be the moderator for today. Dr. Avery Hines will begin with the latest clinical, vaccination, and epidemiological updates. Dr. Hines, morning.
Thank you, Mr. Alexander. Good morning to my colleague, Dr. Surju Singh. Good morning to members of the media, members of the viewing and listening public. If we can have the second slide up, please, the slide with the update, we can go through it together. As at the 22nd of August at 4 p.m., we have tested 296,840 samples. Of those samples, 43,033 have tested positive for COVID-19. Of those, there have been 1,225 fatalities, and we extend our condolences to members of the bereaved families. There have been 36,468 recovered patients in total, and there are currently 5,340 total active positive cases. The active cases are divided as follows. There are 4,867 cases currently in home self-isolation. There are 303 individuals in hospital, and there are 99 persons in step-down facilities. There are also 129 individuals in state quarantine facilities, and yesterday's testing would have revealed an additional 71 new positive cases of samples collected between the 18th and the 21st of August. Moving down to the vaccination stats, what we would note is that as at 4 p.m. yesterday, there have been a total of 483,269 individuals who received at least a first dose, and individuals fully vaccinated comprise 367,691 persons, which is just about 26% of the total population. Moving directly into the epidemiologic update, if we move to the next slide, we will see, once we remove the banner at the bottom, thank you, that we have our typical epi curve. The figures over, or the bars over to the left in gray are last year. The ones in color over to the middle and right are the months corresponding to the months of the year, January through August. The highest bars you would see are those in the gold, which correspond to the month of May. And we'd see that from about the middle of May come down, we had seen some form of decreasing cases through the middle to the end of May, through June, into July, and between July and August, we see that those bars have remained approximately the same height and are actually maybe a little taller in the first part of the month of August, indicating a plateau or a slight increase as we move into the month of August. So we're seeing that the decrease from May through June into July has now basically hit a plateau where we're seeing similar numbers of cases over a protracted period. If we move into the next slide, we see the same data now presented on a weekly timescale. The same information can be probably a little better seen, and you see that those fuchsia bars which correspond to July and the indigo bars that correspond to August are approximately similar in height, and we have the background of that salmon area which represents the positivity, that is the total number of positives out of every 100 cases that we test for COVID-19. And we see that that has varied. It's varied between the high 30s, coming down to low 30s in July and August, and now we're looking at high 20s, low 30s as our current positivity, and we keep an eye on that, and that gives some idea of the level of viral circulation. It does not represent the percentage of positives in the population, but what it represents is the percentage of positives out of those who have respiratory illness and are coming forward for testing. Next slide, please. Same information, again represented now on a monthly timescale for those who relate better to the months. And again, similar information, background positivity somewhere around 30%, and the decrease that we saw from May into June, into July, and August now catching up with July as the month draws to an end. Next slide. Next slide shows the demographics, that's the age and the sex distribution of the positive cases. And we see that similar pattern where the middle bars are the longest, and those middle bars really correspond to that 25 to 49-year-old age group. The ones at the bottom bars are the under 19, so 19 and under. You see that is constricted, representing some level of protection of that younger population. And we see overall that the males and females account for approximately half and half of the cases that have tested positive. Next slide. Among the fatalities, we see that there is a predilection for the older age group. So the bars at the top, representing the older age groups, are the wider ones. But we do note that we have deaths in age groups under 50 as well. And we remind the population that one of the factors that really influences that outcome is the presence of comorbid conditions, additional chronic illnesses that can make it harder for your body to respond to the COVID-19 disease. And therefore, we urge all individuals, especially those with comorbidities, to get vaccinated. We also see that male-female balance has now swung to about 57-43 in favor of the men, but it's down from the 75% male that it was in previous times. Next slide. Geographic distribution. Continue. Next slide. We see again that we have that general distribution around the population centers, more densely populated places having the higher numbers of cases. And we note that those numbers do seem to be coming down a little across communities, but we still have some areas in which we find that our numbers are going up instead of down. Next slide. If we look at that at a county level, we can compare previous week with current week. In this case, we're seeing Epi weeks 31 and 32. 31 being the cases and bars in purple, 32 being the cases and bars in gold or yellow. And we do see across the board that there has been a decrease in the number of cases from week 31 to week 32 in all the counties, with a couple exceptions. And while we note the exceptions, we note that overall downward trend is the direction in which we would like to continue to go, but we have to adhere to the public health guidelines. We have to increase our levels of vaccination in order to drive that number further downwards. And if we move to the last slide, we see that same information now just in bar chart format, where you can see each county and the change from one week to the next. The last and the penultimate bars for each county representing week 31 and week 32. And we see that in many cases, there were decreases, with a couple notable exceptions. In Anderson, David had an increase instead of a decrease, so too Tobago, but the rest of them did have some measure of decrease across the board. I think Nirivamero had a marginal increase as well. So we do want to continue to advise the population to stick with the public health guidelines, continue to wash your hands, continue to wear your masks, continue to watch your distance, continue to adhere to the avoidance of gatherings, not gathering in places in numbers over 5, and not gathering unnecessarily, as we continue to fight the spread of the virus with both the public health measures and the vaccination drive. With that, I'll turn you back over to Mr. Alexander.
Thank you very much, Dr. Hines. Thank you very much, Dr. Hines. The vaccination of pregnant women and women planning on becoming pregnant is an area that the Ministry of Health has approached cautiously. Dr. Sujit Singh is here this morning to update us on the recent decisions made by the ministry and its stakeholders regarding the vaccination of this very important group within our society. Dr. Sujit Singh, welcome.
Thank you, Mr. Alexander, and good morning to my colleague, Dr. Hines. Good morning to members of the media and to the viewing and listening public. So I could start directly with the slides, if you don't mind. The first slide, just to have a little background as to who I am. This is an important slide, I think, because far too often there's a lot of misinformation that starts as soon as we have these press conferences, especially when we have these emotive issues related to pregnancy and vaccinations. So as a little background, I am the director of Women's Health, and we are a unit which really we are trying our best to improve the health of our mothers and newborn babies. We were formed approximately 4 years ago, but I come with 31 years plus experience as a health practitioner, an obstetrician and gynecologist. I'm a specialist also in administrative. I have actually been involved in the care of thousands of babies in Trinidad and Tobago as well as the United Kingdom. Can I have that next slide, please? So I was here approximately 2 weeks ago, and I did state that at that time we had 285 pregnant women, and we have now an additional 30 cases, and this is up to last week. So this is a moving target. I also said in the past that pregnancy is a higher risk than the general population. All our cases are in various stages of pregnancy. As you would appreciate, some would have had their COVID infections in early pregnancy, so not all would have delivered. Some of our patients ended up in the high dependency unit and the intensive care unit, and there still are patients in the intensive care unit. I also spoke of a maternal death recently. Now, this patient actually came in the later stages of pregnancy, had a successful delivery. She had COVID-19 at the time of presentation. Her baby is doing well, was taken care of by a specialist team of doctors in the neonatal care unit, but unfortunately our patient passed away a few weeks after she had delivered. So I know there was a little bit of misinformation in the way it was portrayed last time. Maternal deaths actually covers all the way up to 6 weeks past your delivery date. Next slide, please. Just to reiterate, all pregnancy is considered high risk, but especially if you're over 35 years of age, diabetes, high blood pressure, obesity, asthma, and if you're in the second half of pregnancy, these are additional risk factors. Next slide, please. We already said this information, but essentially the complications include there's no direct fetal effect. There are, however, you can go into preterm labor, and therefore preterm babies have complications. Possibly there are stillbirths, and transmission from mother to baby is quite rare. We have one recorded case. So in addition, I just want to re-emphasize that even if you have COVID-19, breastfeeding is safe and highly recommended. Next slide. So I need to provide an update as respect to breastfeeding and the Sinopharm. We said before that the Sinopharm was approved for breastfeeding mothers as of the end of June, and this has been successfully rolled out. So for the general population, we are asking persons, if you live with a pregnant woman or children in your household and you are eligible for vaccination, please ensure you take the opportunity to get vaccinated as soon as possible. And of course, we continue to follow all public health measures. Next slide, please. So we come to the question, and which we have been speaking about. I know Dr. Hines would have mentioned some information at one of the press conferences, as well as Honorable Minister on Saturday's conference. And that's why I'm here today to provide a more up-to-date bit of information. So in line with international organizations and the World Health Organization, they have approved vaccines which can be offered to pregnant women and breastfeeding mothers. For any country in consideration, we of course have to have a WHO pregnancy approved vaccine in your country before it can be offered. So we should offer the high-risk women first if your vaccine supply is limited. These are some of the decisions and the questions we pose before we make these recommendations. We emphasize that vaccination remains voluntary. We, however, as healthcare professionals, highly recommend vaccination as a proven public health response to reduce persons getting ill or dying. Next slide, please. In terms of consensus, this is not a quick decision. This is something we have been considering for several months. We have to be guided by the local data. We have provided that information. And as you would appreciate, data has to be published in international scientific journals. So, as of last Tuesday, which was the 17th of August, we had a final approval meeting, and as guided by the PAHO WHO, we are about to roll this out. Next slide, please. So let me tell you a little bit about this meeting that occurred last Tuesday. So this meeting was at the request of the Honorable Minister of Health, and we had key stakeholders convene to come to a consensus on the use of the Pfizer-BioNTech vaccine, which we'll shorten as Pfizer vaccine, in our pregnant and breastfeeding women. The meeting was led by a team from the Ministry of Health and included their Chief Medical Officer, Dr. Roshan Parasram, and myself. The stakeholders included, the next slide please, the Pan American Health Organization, the World Health Organization, and these were some experts based at the Washington, D.C. office. We had the CAFA, the Trinidad and Tobago Medical Association, the National Immunization Technical Advisory Group, which is a group of a number of experts. We had all obstetrics and gynecology and neonatal intensive care unit heads of departments and nursing staff from all of the RHAs. We also had a wide cross-section of private sector obstetricians included in the on the online presence as well as physically in the meeting. We also had senior representatives from the University of the West Indies as well as written submissions in support of the vaccination. So next slide please. So I am pleased to announce, therefore, as of Wednesday, 25th of August, I have the dates correct there, Al, we will be rolling this out at all our sites that currently administer the Pfizer-BioNTech. So I'll go into a little bit more detail. So we are recommending the use of the Pfizer vaccine for pregnant women, and of course regardless of nationality, after they have completed the first trimester. So you are in week 13 onwards. We divide pregnancies into trimesters, 40 weeks being the due date that we work out for you. So the process really, it is based on the advice of your healthcare provider. The documentation for a patient to access the vaccine, you are not allowed to simply turn up to the site. You have to go through your antenatal care provider, be it in the private sector. It could be your general practitioner. It could be your specialist obstetrician and gynecologist, your local health center, or it could be from a hospital. We have a new form we have created to identify women who can take this form along with their identification to the mass vaccination sites that are currently being used for the rollout of the children's vaccination, which is those under 18 years of age. Next slide, please. No consent is needed if you're over 18 years of age. When you get to the site, pregnant woman, you'll have this form. You indicate to the ushers and the staff at the centers that you are pregnant, and they will assist in fast-tracking you to get your vaccination. This has already been arranged for you. Walk with a pen, make it easy. Have clothing that's easily, so your arm is easily accessible. Walk with your antenatal records and a form of identification. Now, there is an additional form which is also available that you can download if you have that capability from the Ministry of Health's website. That's the normal vaccination form. This will make your process even faster. Bear in mind, you will be observed for approximately 20 minutes following your vaccination. For those coming from the private sector, you don't actually need that form. Your doctor, if you're a GP, you can write a letter for your patient saying that they are indeed pregnant, who the patient is, and that they have indeed crossed 12 completed weeks. They're in week 13 and beyond. Next slide, please. There are a few exceptions. As always, we try to think about all the exceptions that may happen. We know there are breastfeeding mothers right now, and they're asking, can I get the Pfizer vaccine? The answer is no. We don't currently want to complicate matters. We are sticking to the original approval where Sinopharm is for those who have already delivered and are currently breastfeeding. For those who go into pregnancy and they've had their first dose of Sinopharm, at this time we are not allowing mixing of vaccines. So to answer the question, you are not going to be eligible for this program. For those who are underage, you follow the current system where you will have to sign forms, a guardian has to approve. These are for mothers who are actually underage. We do have those. About 1%, 1.5% of the population are under 18 years of age when they give birth. These persons are allowed to have Pfizer. And there's another exception. If you had the first dose of Pfizer at the end of pregnancy and you do your second one after you've delivered, of course, you will be allowed to have your second dose of Pfizer after you've delivered. The vaccines are approved for breastfeeding. And the last in these slides is just for noting is the form we have created, which we have already disseminated. It's in the hands of all of the regional health authorities. It's in the specialist medical officers, specialist doctors. These forms are already available, and we will be using these forms as of Wednesday morning. You are eligible to get vaccinated. Thank you, Mr. Alexander.
Thank you, Dr. Sergio Singh. But before we go into our question and answer segment, I do have some frequently asked questions that I would like you to answer for the benefit of our audience. I've written them down. Can you tell us a little more about the safety of the vaccine and how it works in protecting pregnant women?
Right. So yes, and of course, this is the first question I think everyone will ask. We, as I said before, we actually had a long deliberation. We looked at a lot of the scientific information. These are called the mRNA type vaccines. So the technology has existed for quite a long time before they were employed in these current vaccines. There are databases of over 250,000 pregnant women who have already received these vaccines across the globe, especially in the United States, United Kingdom, and Europe and Canada. 250,000 plus women. In addition, other countries haven't yet entered the data into their database. So we have not seen any issues with respect to the vaccines in our pregnant women in terms of outcomes, except that we know the vaccines work in protecting these pregnant women from getting the COVID virus infection.
But will there be side effects, and how is it different from the side effects that non-pregnant individuals receive?
So good question again. So pregnant women, from the data, from the studies, can expect there's absolutely no difference in terms of the side effect profile. So you can expect, of course, the usual things which we continue to say. You may get soreness in your arm, pain in your arm, discomfort. Some people get headache, a little feeling of tiredness, which is usually short-lasting and limited. Very rarely would there be any major adverse effects.
Okay. And what about the number of doses? Just for emphasis, how many doses would a pregnant woman expect to get, and that whole issue of it being mandatory?
Right. Yes. So thank you, Al. Yes. So of course, the current program involves a double dose. So it's one dose now, which you need that form, hopefully, to access the service. You'll get an immunization card with an appointment generally around 3 weeks afterwards for your second dose. As I said before, if you're close to delivery, you may have delivered when you're accessing that second dose. So that's the process. Mandatory vaccines, as we said before, we are not mandating any vaccine at this point in time. For pregnant women, it's a totally voluntary process, as informed. Hopefully you're getting the right information from us. Try not to look at the uninformed persons who comment on social media to be the source for your information.
Exactly, understood. Now, can a patient take Pfizer if she wants to become pregnant or if she recently had a baby?
Right. So, yes. So of course, it's basically we are advocating it for pregnant women. This is the initial phase, I would say. Before we look at expanding the grid, of course, everything is priority. So our priority right now would be the pregnant woman. So if you're trying to get pregnant, you have many other choices available to you, which you can take. And as we heard, we now have the single dose Johnson & Johnson vaccine also available. So please take those before you get pregnant, especially if you're in a high risk group as well. And of course, after delivery, we have the Sinopharm vaccine as well.
Okay, excellent. Next question. Can you clear up some misinformation that was recently in the public domain regarding women who are on the oral contraceptive pill and the taking of COVID-19 vaccines?
Right. Okay. Yes. So actually, thanks for this one. So this is a little off topic from what I came to speak on, but it's important for women as a whole. Of course, there are lots of experienced specialists, obstetricians and gynecologists who sometimes try to help the process and explain things when they are asked on the media. But in terms of the Ministry of Health, the trusted sources of information, we are going to say that the World Health Organization, the scientific community, the international support says to tell patients do not stop their contraceptive pill or any form of contraception before taking a vaccine. It is ill-advised to try an alternative method. So that's very important message.
Okay, thanks a lot, Doc. Hypothetical question. A patient gets a COVID-19 vaccine early in pregnancy, before 12 weeks. Should she become concerned after hearing today's advice about starting vaccines after 12 weeks?
So firstly, for anybody in the general population, any woman, of course, who potentially can get pregnant, the advice is you can safely take your vaccines. But we know that some women will indeed get pregnant after taking their first dose, if it's a 2-dose type of vaccine. So the World Health Organization clearly says that there's no need to do pregnancy tests. If someone finds out they're pregnant after taking the vaccine, we have enough data to say that it's safe in the first, even if it's in the first 12 weeks. But what we are doing, we are following the WHO's guidance, which we recently received, which says just for an added level of safety or comfort, really, let's start at the 12-week and beyond, after 12-week population, just for that added level of security.
Okay. And finally, would the vaccines protect women against the variants?
Mm-hmm. So this is an excellent question that everyone keeps asking and concerned about. We are looking at the international media and for our sources of information, and we see it's quite clear that all vaccines, regardless of brand, are showing to have a high efficacy in terms of protecting the population, regardless of which variant is there at this time. We are encouraging persons to get vaccinated, so to avoid new variants arising as well. So I hope that answers all of those questions, Mr. Alexander.
Thank you very much. I hope I didn't put you on the spot. Thank you very much.
Thank you.
Ladies and gentlemen, we now move to the question and answer segment. Our media representatives are all familiar with the interviewing guidelines. Please state your name and the name of the media house that you represent before asking 2 brief questions. Ask your questions one right after the other to the relevant members of the panel. And again, if time permits, we will accommodate a second round of questions where 1 question per media house will be accommodated. Today, we begin our question answer with CL Communications.
Hi, good morning. Natalie Singh, Caribbean Lifestyle Communications. Just wondering, my question is for Dr. Hines. What sort of preparations or measures are there in place at the vaccination sites for those who would have allergic reactions to the vaccines? And then my second question is the Ministry of Health monitoring the statistics on people who have been infected with the virus, but who are not vaccinated and are being admitted to the hospital? So is that trend being looked at, and is in fact that important to the Ministry of Health? Thank you.
Okay, thank you for the 2 questions. As I believe has been stated before, the particular sites that have been highlighted and selected for the administration of the Pfizer vaccine in particular have an additional level of both training and support to deal with any sort of anaphylactic or allergic reactions that may arise. Now, this is available at all the sites, but then given the awareness of the news reports that have happened in other countries with that slightly highlighted risk of anaphylaxis, the additional training and the additional technical support, ambulances, medications, etc., to deal with anaphylactic reactions is in fact in place at all of those sites. With respect to the second question, I'm not quite clear what you're asking, because I know that we have, in fact, actually put statistics into the public domain before regarding the hospitalization of both vaccinated and unvaccinated individuals, showing that the vast majority of the individuals currently being hospitalized are completely unvaccinated, and that the remainder are generally individuals who have only had a first dose of vaccine, showing that the fully vaccinated individuals aren't showing up in the hospitalized and seriously ill cases, and so too among the fatalities. So I'm not sure if you're asking about something else, but I know we have clarified that, and we will continue to update that data as time rolls on.
Thank you very much, Dr. Hines. We now move to the Guardian newspapers. Guardian, good morning. Guardian?
Good morning to all.
Go ahead, please.
Good morning to all panel. Analyst Paul Garden.
Okay. We seem to have a little bit of technical difficulties with Guardian, so we will move to Tobago Channel 5. Candice Jackson, we are ready for your 2 questions.
Hi, good morning, Candice Jackson from Tobago Channel 5. My first question is for Dr. Surju Singh. Would immunity be passed on from mother to baby with the Pfizer vaccines? That's the first question, and I'm not too sure if Dr. Hines might be able to answer this, but could we have an idea of the expiration dates for the Pfizer vaccines and the Johnson & Johnson vaccines, which just came into the country?
Yeah, I'll go ahead and take the first question out.
Please.
Yes, thanks. Okay, thank you very much for that. Very good question again. So that's the whole purpose of this as well. So it's about protecting the unborn. When mother takes the vaccine itself is actually excreted from the body. The body gets rid of it very quickly, but the immune response continues, and you make antibodies. The vaccine cannot pass across the placenta to the baby. So that's the first level of safety we know about this vaccine. The antibodies, however, against the COVID virus pass to the baby and give some level of protection. So when that baby is born, remember these young babies cannot be vaccinated, but they can get COVID-19. So a mother who takes this vaccine is actually protecting her unborn child. You're doing something tremendously important for that child. In addition, you keep breastfeeding, which is the best food for your baby, of course, but antibodies will continue to go from mom to the baby in the breast milk and give added protection. So it helps me to reinforce that very important point. Thank you.
Okay, thank you for the second question. I am actually inquiring just to ensure that we give you correct information on that. When that information comes to me, we will share the expiration dates. I don't have them in front of me at the moment, but they will come to you during the course of the broadcast.
Thank you very much, Dr. Hines. We will now move to Newsday for your 2 questions. Good morning, Newsday.
Yes. Good morning, Clint Chantak of Newsday. My 2 questions are, firstly, I wanted to get an idea of the schedule of the rollout of the Johnson & Johnson vaccines that we have recently acquired. The first tranche of them, when is getting.
Okay, Mr. Chantak, could you repeat your questions? They seem to be having some connection challenges.
We heard the first question. What's the second? The first is the schedule of the rollout of the Johnson & Johnson. Mm-hmm. Second question is?
Okay, so
all right, we're having some trouble with the audio there. I'll just take the first question.
Yes.
So as the minister had indicated, the Johnson & Johnson vaccines are being targeted for those rural communities, the ones that have difficulty with access because of the advantage of only having that one shot and you're done. And that is actually expected to commence from the Wednesday. What day?
Wednesday 25th.
Wednesday the 25th, and that program will continue to run from Wednesday the 25th go forward. At some point, if we get the second question, we'll try to answer it as well.
Thank you very much, Dr. Hines. We now go to Renessa Cutting, TV6. Good morning.
Good morning, Renessa Cutting, TV6 News. You all are hearing me fine?
Yes.
Yes, we are.
Okay. We have been receiving unverified reports of children having had very adverse effects to the Pfizer vaccines, including one supposed fatality. So I would like the Ministry of Health to confirm or deny these allegations at this point, and just to give us any information where it concerns any or all adverse events that were recorded since the rollout of the Pfizer vaccine among children. And my second question is to Dr. Surju Singh. What I want to know is, given that we've been in this pandemic for a little over a year now, and the average pregnancy lasts 10 months, would you say that enough time has elapsed for there to be sufficient research into how a child, a fetus, or the child could be affected developmentally following the mother having received the 2 doses of a vaccine? Thank you.
May I take the second question first?
Yes, please.
Yeah. So, yes, thank you for that very good question. And so, essentially, the technology behind all of these vaccines have been around for many years. We have already said to you, we know of the safety profiles. We are putting an additional level of security in the system by what's called the period of organogenesis. In those first 3 months of pregnancy, this is a very critical time. So we added another layer. We weren't asked to do that specifically at the start because worldwide there are, as I said before, over 250,000 women who have successfully received the vaccines. Of those, several thousand would have had their babies in the first trimester already. We have seen absolutely no problems so far. You are right. There's no way we can tell you 10 years from now, 20 years from now. We can just reassure you from all the vaccines that we've been using in the past that there is so much safety in what we are doing at protecting persons from dying and getting into a hospital and protecting these unborn children and these newborn babies. Really, that is the essence of what I need to say. Thank you.
Okay, thank you for the other question. You're quite right in calling those reports unverified. We have not received any such report, especially any report of a fatality. We have received a report of at least one allergic reaction, which was handled by the health system, and the individual in question is actually quite well at this point in time. And as those events come up, you will definitely be notified if there's any trend that indicates any problem or any danger. The objective of the vaccination program and of the health system is to improve health and to avoid risk. So if any information comes up that suggests risk, then the ministry will, of course, take the necessary steps to reduce that risk. So we have not received any of those reports that you've spoken about, and the one report that we have received of an allergic reaction was handled within the context of the health system quite successfully.
Thank you very much, Dr. Hines and Dr. Surju Singh. We now go to 103.1 FM. We're ready for your 2 questions.
Good morning, everyone. Sira Chandu from 103 FM. I actually just have one question that I would like to pose to Dr. Hines. Over the weekend, we received an email informing us of the setting up of a vaccine adverse event reporting system for TNT. Now, there is such an organization, such a platform, in the United States that's co-managed by the CDC and the FDA. Of course, disclaimer with that the data there is unverified. The VAERS TT specifies that it's a private organization collecting data regarding reactions or adverse events associated with these COVID vaccines. Dr. Hines, what are your thoughts on this, and how do you anticipate it will make the complicate the dissemination of information and data in the country?
Okay, thank you for the question. Quite an interesting one. Now, what you would note is that those various systems are really those that are associated with the phase 3 of vaccine trials. They're associated with trial drugs, and they're funded and supported by the agencies that are actually running trials at that point in time. It is not a system that is required after the trial has been completed and the vaccine's side effect profile has been characterized. Now, be aware that the ministry's rollout of the vaccination program is not a vaccine trial. While the CDC and these other agencies may continue to collect information via that system, that VAERS system, as you well noted, it is unverified, meaning there is no clinical verification of what is being put into that system by the members of the public that access it freely. What the ministry has in place is the existing ESAVI, or the event supposedly attributable to vaccination information system, that it has been in operation since the vaccine immunization program, that expanded program on immunization, has existed. And that system is the one that is being used quite successfully to collect any information on any serious adverse events, and it is then backstopped or supported by a verification process, a clinician verifying what has been said, whether a vaccine has actually been administered, and then that information is passed up to the central level. Now, any other system that claims to be in place does not have the support of any data protection as far as we're aware. It is not being monitored clinically by any clinical specialist associated with the ministry, and whatever information is being put into such a system then cannot really be verified. So what we would advise is that the systems that are already in place for the collection of any adverse event data, those systems continue to be used. At any health center or emergency room, you can go and report your symptoms, report when you took the vaccine, show your vaccination card. That information is going to be passed up to the expanded program on immunization in a manner that allows for verification. And we hope that that is the system that will be utilized for reporting any adverse events, especially serious ones. Because if any information is put into this other system, that's not information that will reach the Ministry of Health. So I hope that helps to clarify, to some extent, what is in place with the ministry and what is best used. Circling back to the expiration dates, we have the 30th of November 2021 for the Pfizer vaccines and May 2023 for the Johnson & Johnson.
Thank you very much, Dr. Hines.
Microphone.
We'll now go to,
Mic.
Thank you very much, Dr. Hines. We will now go to azpnews.com for your two questions.
Good morning, everyone. My two questions. This is Suan Wire from acpnews.com. My two questions are, where exactly will the Pfizer vaccines be administered to pregnant women? And what other vaccines, if any, are approved by the WHO for pregnant women? And would the ministry be attempting to source those for this group as well as others? Thank you very much.
Okay. Thank you. I'll take the questions. So we have said before, and it's actually been published. I don't have the entire list in front of me, but there are the exact sites, the so-called mass vaccination sites that we are using for our children at this stage. So you simply present to these same sites as of Wednesday morning. You identify yourself as being pregnant. You may have this form helping the identification process. You will be fast-tracked to have your vaccine in parallel with children at those sites. More sites are actually being rolled out as we speak. So you will need to check the Ministry of Health site and all the RHAs for the updated list. The second part of the question was to do with more vaccines, I believe. So at this time, not to confuse matters, we are trying to make this so that there's no mix-up in the rollout of any program. We are switching with the we are sticking with the Pfizer vaccines for our pregnant women, and we are expecting more Pfizer vaccines, as you know. So at this time, we will not change our process. We do have that option because several of the other vaccines are indeed also approved for pregnancy, but we certainly do not want to confuse the population in the initial rollout. Thank you.
Thank you very much, Dr. Surju Singh. We will try to circle back to the Newsday to see if the connection has been cleared. Newsday.
Okay, Kunchantake again in Newsday. Are you all hearing me?
Loud and clear.
Okay, good. The second question I had, there's been a lot of discussion recently about the use of something called COVID-19 blockers to sort of boost immunization, and particularly against the Delta variant. Now, you have a few countries like the US are thinking about this sort of thing. What's our position regarding the use of COVID blockers, either to enhance or our current vaccination drive, and given the levels of vaccines that we currently have and who we're targeting and so on? So that's basically my question. What is our position? Where do we stand in this country regarding the use of COVID-19 blockers, given where we are at with our vaccination strategy?
Okay, thank you for the question. Short answer is we continue to be guided by and to follow the recommendations of the WHO with respect to approved technologies, approved interventions, whether they be medical or the vaccination. So whether they be therapeutic, meaning treating, or vaccination, which is a preventive measure. So at this point, where those don't fall under that category of WHO approved, our position is that we will await additional data on the performance of these before making any further decisions.
Thank you very much, Dr. Hines. Ladies and gentlemen, we have come to the end of today's media conference. A special thanks to all our panelists, our media representatives, and you, our viewing and listening public, for spending the last 45 minutes, 50 minutes with us. We ask that you please continue to protect yourself and your loved ones. If you haven't received your COVID-19 vaccination as yet, please get yours now. Remember, the COVID-19 vaccines are safe, they are effective, they are free, and they are very available. No appointments necessary, and you have a multiplicity of locations. So let's all do our part. Let's vaccinate Trinidad and Tobago. Goodbye for now.
There are millions of different types of viruses. Some, like the COVID-19 virus SARS-CoV-2, can infect humans, meaning that they enter and use our bodies as factories to make millions of copies of themselves, causing damage and disease before moving on to someone else. What is a variant? Every time the virus enters a new person and starts copying itself, mistakes can be made. Those mistakes are called mutations. A virus with one or more mutations is sometimes referred to as a variant of the original virus. Most mutations have little or no effect on the virus, but some give the virus an advantage, allowing it to spread more quickly or cause more severe disease or to escape some of the immune system's defenses. If you are vaccinated and you do get infected, the chance of you ending up in hospital or dying from COVID-19 is extremely low. Much, much lower than if you did not get the vaccine. The vaccines are safe and effective. I got my vaccine because I want my immune system to be prepared and to have the best chance against COVID-19. Not just for me, but for my children and my loved ones. So, I encourage you to get the COVID-19 vaccine for yourselves, for your families, for your loved ones, for TNT. Let's all do our part and vaccinate TNT.